All right, today we're going to talk about something that hits close to home for so many people. It's that fear that can feel really isolating, but trust me, it's super common. We're talking about the fear of the dentist.
Does that sound familiar? You know, that feeling of dread when you even think about a dental appointment? If it does, you are definitely not alone. For a lot of folks, it's way more than just a little bit of nerves. It's this powerful, totally overwhelming feeling that can be just so hard to handle.
Well, believe it or not, that feeling actually has a name. It's called dentophobia. And yeah, it's a real, recognized phobia. We're talking about an intense, sometimes overwhelming fear of anything to do with dental work. And the trigger? It could be literally anything. The whirring sound of a drill, or even just that very specific smell you only find in a dental office.
So, you might be wondering, where does a fear this strong even come from? Well, it's not just random. The roots of this kind of anxiety are actually really common, and when you hear them, they make a lot of sense.
A lot of the time, this whole thing kicks off because of one single bad experience. Especially when we're kids, right? A procedure that really hurt. Or maybe just feeling like the dentist wasn't listening. That kind of thing can leave a mark that sticks with you for years.
Now, for some people, the fear is super specific. It might be the thought of pain itself, or a full-blown phobia of needles that's actually called trypanophobia. And for others, just seeing the dental tools laid out on the tray is enough to send their anxiety through the roof.
And then there's a big psychological piece to this puzzle. Think about it. You're lying back in that chair, you can't really see what's going on. It can make you feel completely helpless. That feeling of losing control, that's a huge trigger for a ton of people.
It's also really important to know that sometimes dentophobia isn't just a standalone thing. It can actually be tied to other conditions, like a generalized anxiety disorder, where you're already dealing with a higher level of worry in your day-to-day life.
Okay, so how can you tell the difference between just being a little nervous and having an actual phobia? Let's get into what the specific warning signs really look like.
And look, this is the key thing right here. We're not talking about those normal pre-appointment jitters that a lot of us get. Dentophobia is a whole other level of distress. It's the kind of intense feeling that literally stops you from getting the care you need.
The symptoms really show up in a few different ways. Mentally, you could be looking at severe anxiety or even full-blown panic attacks. Then there are the physical reactions, things like sweating, a racing heart, maybe feeling nauseous. And behaviorally, the biggest red flag is just completely avoiding the dentist. Pushing appointments back again and again, sometimes for years.
And as you can probably guess, avoiding the dentist like that has a huge ripple effect. The consequences go way beyond just what's happening in your mouth.
It really creates this nasty, vicious cycle. So, you fear the dentist, which means you avoid going for checkups. Then, small problems turn into big problems, the kind that need more intense, more expensive treatments. And of course, that just makes the original fear even worse. It's a really tough cycle to get out of.
But, and this is a big but, here's the good news. That cycle, it can absolutely be broken. There are real, practical ways you can manage this fear and start to take back control.
There are a few different paths you can take, and they've all been proven to work. First up, there's therapy. Something called cognitive behavioral therapy, or CBT, is amazing for helping change the thought patterns that are driving the fear. Then you've got relaxation techniques, simple things like deep breathing that you can do in the moment to calm your anxiety. And for really severe cases, there are medical options, like anti-anxiety meds or sedation dentistry, which are totally safe and valid ways to help you get through it.
The number one thing to take away from this is that this is treatable. You don't have to live with it forever. Finding the right support system, whether that's a dentist who really gets it and is compassionate, or a professional therapist, can completely change the game. It makes it possible to take care of your health without all that anxiety weighing you down.
So look, just realizing you have this fear, that's the huge first step. And knowing that there are solutions out there is the next. So I'll leave you with this. What's just one small thing you could do, maybe even today, to start moving toward that healthier, less fearful smile?